Members, our first bill on the agenda today is House File 4366 from Representative Edelson. I see she is at the table and ready to present. Representative Edelson, would you like to move your bill?
Yes, Mr. Chair, I'd like to move or refer House File 4366 to the Public Safety and Finance Committee.
Very good. Thank you, Representative Edelson. I understand that you also have an author's A1 amendment. Would you please move that and explain the A1 amendment?
Thank you, Mr. Chair. I would like to move to incorporate the DE1 author's amendment. If the committee would be so kind to adopt this amendment, I can speak to the overall bill.
Thank you. Thank you, members. Any questions or comments on the DE1 author's amendment? Hearing none, all in favor of approving the DE1 author's amendment signify by saying aye.
Aye.
Opposed, say nay. Motion is approved and House File 4366 is amended. And as we start this bill, I want to make folks aware that we'd like to wrap this one up by 1:30 to keep on time today. Representative Edelson, please explain your bill.
Thank you, Mr. Chair and members. House File 4366, as amended, is the Priority Admissions Law, more commonly known as the 48-hour law, was enacted in 2013 and requires the Commission of Human Services to provide individuals being admitted from the county jails to the state-operated treatment facilities. The work of the DE1 so far, I want to be very clear with the committee, is currently in progress. We have another meeting on Friday. We have 5 stops for committees. We will continue to work on the legislation before you. But just so you know, the work before you is the result of 18 members of the Priority Admission Task Force that started to meet. We passed a task force bill last year in the session, and the recommendations of this report, I believe, came out the first day of session. I do recall reaching out to some of the chairs to make sure they knew that I was going to be starting to work on the bill. The task force representation included hospitals, sheriffs, direct care and treatment, NAMI, community mental health, the ombudsperson for mental health, counties, county attorneys, commitment defense, a member with lived experience, a chief of psychiatry, the commissioner of DHS, Jody Harpstead, as well as the attorney general for the state of Minnesota, Keith Ellison. The priority admission report made it very clear that not one system stakeholder could meet all of the needs. The population the committee is aware of, just so you're aware of, are people that are civilly committed, that are languishing in our jails and in our hospitals. It was a consensus that the problem of lack of access and capacity existed prior to the creation of this law in 2013, and it persists today. The task force recommendations that we are working on that some are incorporated within the DE1 include 9 recommendations. And I'm going to read through those so the committee knows. And I don't know if we made available the task force report, but I most certainly can send that to the chair after this. But it's to begin immediately increasing capacity of direct care and treatment facilities. It also is to form a joint incident collaboration group to help actively facilitate discharges for the DCT patients, approve the exception of the priority admission law, create the implementation of the new priority admission law criteria for direct care and treatment, increase access to services provided in the community, provide funding to administer mental health medications in jails, and relieve communities of some cost counties, for some cost for individuals waiting to transfer to other DCT facilities. It also works to expedite Minnesota Section 1115 waiver application for individuals in custody, which I know Chair Noor is also working on, and it increases forensic examiner accessibility. Now, I want to be clear, there are separate bills for many of these things. We are incorporating them into this larger bill because that is the work of the task force. So with that, Mr. Chair, the work is obviously continuing, and I would like to move to the testifiers.
Okay, very good. Thank you, Representative Edelson. We will move on to the testifiers. The first testifier I have on the list is Sue Abderholden. If you'd like to come forward, please. She might. Okay. How about Ginny Palin? Yeah. There we go. Welcome to the committee. Thank you for being here. Please introduce yourself and begin your testimony.
Thank you, Mr. Chair, and thank you, committee members. My name is Ginny Palin. I'm with the Minnesota Association of Community Mental Health Programs. And Ms. Abderholden, I believe, is also testifying in another committee right now, so she'll try to, but I'm here to also help support some of the positions in here. The MAC-MAP, or our association, was one of the members listed, and I participated in the task force. The task force was put together, and MAC-MAP's representation was to help represent the community side of behavioral health services in that continuum. The task force, I think, and throughout their discussions, determined that this problem is very large and very comprehensive and consists of both internal as well as external care capacity issues and concerns. The task force also agreed that the solutions to civil commitment admissions must also be comprehensive and address both the inpatient and community services upstream and downstream to them. Yes, Minnesota does need more inpatient capacity, both for our state-operated services as well as our other community-based hospital services. And we need to invest in our community-based services to prevent situations that we can from becoming so acute that they need inpatient care, as well as supporting the capacity to discharge clients to more residential or appropriate care when they need to move to less intense settings. The proposals in House File 4366, including the DE1 amendment, include several key recommendations included in the task force report to solve the capacity gaps in our community-based behavioral health care services, of which I am most qualified to speak to for my part in the task force. These include fixing and increasing our Medicaid outpatient rates to sustain existing community-based services, streamlining our behavioral health regulations to remove client barriers to care, increasing and supporting investments for first episode psychosis, as well as early bipolar disorder grants, and funding resources. Sorry, is my time up?
Yep, I'm sorry, I should have mentioned, try to keep testimony to 2 minutes, I approve.
Shooting us.
Go ahead and wrap up.
The task force report and the House File 4366 represent a large collaborative work across a diverse group of partners trying to address all of these issues with statewide impacts. We look forward to continuing to work with you. We ask for your support of House File 4366. Thank you.
Thank you so much for being here and for your testimony. Next on the agenda is Ian Heath. If you could please come down, and then after Ian Heath, we have Terrell Clark. And once again, please try to limit your testimony to 2 minutes, please. Welcome to the committee. Thank you for being here. Please introduce yourself and begin your testimony.
Certainly. Thank you, Mr. Chair and committee members. My name is Ian Heath. I'm a forensic psychiatrist. Started my career at the Minnesota Security Hospital for 7 years prior to moving on to Hennepin Healthcare. I've been at HCMC for 17 years now, and I'm the senior medical director. I essentially come to you today as a representative of HCMC and Hennepin Healthcare Systems, but I think our experience could be generalized to many other metro hospitals. You've heard kind of the history behind the priority admissions law, but it's, in essence, what this is created as a roadblock so that we are unable to discharge patients from an acute care hospital like HCMC to direct care and treatment facilities. I wanted to give you some idea of the patients that we're caring for and some brief facts. I realize time is very short, so I will try and make it succinct. We have patients in the hospital now for 600, 700 days. Literally years is our length of stay for some individuals. It is untenable. These individuals, some of whom are committed as persons who are mentally ill and dangerous to the public, require a level of care that is greater than what we can provide. I have immense respect for the Minnesota Security Hospital and the colleagues I worked with in the forensic division. I know the quality of care they can provide. These individuals require that level of care. Having them essentially locked in a community-based hospital, acute care hospital for years on end without the ability to engage in the treatment that is necessary to advance their care and subsequent decrease in level of custody is shameful in some ways. It also causes us to forego admitting 50 to 70 people who could have used that bed in the time that that person has occupied that one bed. We deal with frequent assaults. One individual at the hospital is assaulted over 120 times, 59 workers. You get an idea of what we're facing. We are wholly in support of the idea of granting an exception to the priority admissions law to allow 10 patients to rapidly move from community hospitals into direct care and treatment beds, and we support increasing capacity as well as increasing services throughout the system. Thank you, Mr. Chair and committee members.
Thank you for taking the time to be here, and thank you for your testimony.
Thank you.
Next, I have Terrell Clark. Thank you. If you'd like to come down, please, Commissioner. And then next after that will be Danny Ackert. Welcome to the committee. Good to see you again.
Good to see you again, Mr. Chair.
Thank you. Please introduce yourself and
Yes.
begin your testimony.
My name is Terrell Clark. I'm currently serving as the board chair for Stearns County Board of Commissioners. I'm here representing the Association of Minnesota Counties and MAXA. I was the AMC representative to the task force. And because almost everything I wanted to say will exceed your 2 minutes, know that we will follow up in a letter. Wanted to take the time to thank Representative Edelson on working with us and the task force to make sure that we get through this session, the actual key things that are going to start making a difference for the people who are most greatly impacted, those with the highest acuity needs. Not everything is in this bill, as Representative Edelson said. We're going to keep working on that together. There is urgency needed to expand our state-operated system, the capacity as well as the community capacity to meet the needs of those in jails, languishing in jails, as well as those in hospitals and in community. For us, really, the key recommendation here is any change of the statute needs to be linked to increased capacity through the state and community. And we are going to continue to keep working on that. There are a couple other very specific things that relates to counties in here. We'll follow up on the recommendations specifically in the increase of the beds. One of the key priorities is currently counties are picking up 100% of the cost for individuals when an individual is determined not to meet medical criteria for placement, but who they're waiting for that next appropriated bed when there is no available bed due to the lack of capacity in our system. We have no control over how or when an individual is moved between the state and the facilities, and counties shouldn't have to be depleting local property tax-funded behavioral health budgets to cover this cost. The task force also recommends any does not meet medical criteria costs paid by the counties. You'll let me finish this one, right?
Yep.
Thank you, Mr. Chair. Should be redirected from the current pathway, which just ultimately ends up in the state general fund, instead return to the counties to expand the scope of the mental health services to facilities to support individuals and communities. Most of the other items we'll go ahead and send it to you because Representative Chair Newer is here. The MA waiver, the 1115 waiver, right now the language is referring to a particular group of people. There are a couple of states that have requested a waiver to include pretrial. If we really are wanting to solve this, that would be something that the feds could help us with. And Mr. Chair and members, thank you, and I'll be around for questions.
Thank you, County Commissioner Clark. And what I would ask is when you send the letter, if you could send it, the information straight to my committee administrator
Absolutely.
next to Malanger, because then you can get it to everybody and also post it
That
as
would be-
part of the public testimony on the website.
That would be perfect. Thank you.
You're welcome. Thank you for being here today. And next I have Danny Ackert. Please come on down, have a seat. Thank you for being here today. Please introduce yourself and begin your testimony.
Mr. Chair, members of the committee, my name is Danny Ackert with the Minnesota Hospital Association. I'm here in support of House File 4366 as amended. In 2023, patients across the state spent roughly 195,000 avoidable days in hospitals, simply waiting for the right level of care to become available. The unprecedented number of avoidable days is due to multiple factors, but unfortunately comes at a time when admissions to state-operated treatment programs is at an all-time low. Minnesotans who should be treated in a state-operated program often require disproportionate attention and care in community hospitals, including strict security measures best suited for state treatment programs. As a result, community hospitals are often too often providing care in unsustainable situations where multiple assaults on staff are occurring, which requires unit closures, limiting care for many to keep other patients and staff safe. As such, MHA supports many provisions in the bill, and today I want to highlight support for the following. First, the immediate admissions exception for 10 civilly committed individuals waiting in community hospitals. This will immediately place 10 patients in the appropriate care setting and free up community hospitals' resources to serve more patients. It will also reduce violence and staff harm and begin to address the ever-increasing number of avoidable days across the state. Second, we support the new medically appropriate priority admission criteria, which will shift the admissions process away from the patient's location towards the patient's care needs. This centers the patient and prioritizes limited resources based on best medical practices for care. And third, the foundational rate increases for community mental health services, including hospital rate increases. The rate framework will help prevent reliance on crisis care and limited hospital capacity, and it will increase capacity in community care settings. Those settings where discharges from DCT need to go, and hospitals. Rate increases will also better support the desperately needed mental health care workforce that the entire state needs. We look forward to working with Representative Edelson, key stakeholders to advance this bill. Action must be taken in 2024. Thank you.
Thank you for the testimony. Thank you for being here today. Are there any other testifiers that would like to address the committee? Not seeing any members. Representative Key, oops, excuse me, just a moment. There's, yes, thank you. If you'd like to come down, please. Thank you. Welcome. Thank you for being here today. If you'd like to introduce yourself and begin your testimony, please. Thank you.
Thank you, Mr. Chair and members. My name's Elliot Butai. I'm the Senior Policy Coordinator at NAMI, Minnesota, and Sue is tied up in another hearing. So I'll just share some of the things you heard, some of these things on Monday in a bill that focused on prevention, intervention. Those things are the things that keep people out of jail, that keep people out from getting into this position. Also, just a reminder that a lot of people, when they hit this priority admissions time, when they get to the 48-hour law, they've already been in jail for several months. And before that, they had family members who tried to get them help, and it came to this. And I answer a lot of those calls at NAMI of families that don't understand what it means that their loved one's incompetent. They don't understand why they can't move forward. And the common theme is, why, oh why, would we ever put someone who just needs help in jail and keep them there? So the only other thing I would call out in the bill is there's paying for medications in jails, and also making sure that there's no co-pays for the psychiatric meds, which is really important. And we do know stories of people that come out of jail with thousands of dollars of fines for their medications. And also we know people that just won't take their meds if the choice is paying a co-pay or saving that money to talk to their family on the phone or buying something from the commissary. So NAMI's been a part of drafting the bill, and yeah, thank you for your time.
Thank you so much for your testimony. Appreciate it. With that, we will then close the testimony and move on to member questions. Representative Keel, I believe you're the first.
Thank you, Mr. Chair. First of all, are we going to hear this bill again, being there is some conversation about changing it?
No, it'll be going from here. Next is public safety, judiciary, health, and then human services finance. So it's got a number of committee stops that it'll be going through. So it won't be coming back here, but it'll be in human services finance for the final stop. And then health will also hear this bill.
Oh, okay. So are we, do we have a fiscal note requested for this?
Yes, it
Okay.
has been requested.
All right. So I've worked on civil commitment. This is a major task. And I think it was 5-6 years ago when we had those conversations. And I'm not even, I heard somebody say we don't want people to be incarcerated, but when you hear the awful stories of family being killed because the person in question was having a mental health breakdown, I'm not so sure that's horrible. I grew up visiting Fergus Falls when it was a mental health hospital, and I always think that there's a place for that kind of service sometime that we need so that we can help people to be stable. We have to remember that not everybody can be out and about because family and other people need to be protected. However, I'm not thrilled about putting people in jail. I mean, that's not, I don't think that mental health, that is part of the problem. But I appreciate all that Representative Ellison you have worked on. There's a lot in here that needs to happen. But I would say, I can ask you a question, but we still have the finances. And I'm very concerned about this and that we are able to actually fiscally pay for this. It disappoints me that we don't have any of the funds because I think we need to address a lot of what's in this bill. So I'm not disagreeing with most of it, but I'm very concerned about how we're going to cover this and care for it. So we can talk later offline too, so.
Okay. Thank you, Representative Keel, and I will mention that, the finance is going to be looked at when it gets to the appropriate committee at that point in time. They'll have all that information lined up because it's important that we're making sure that we're having the funds that we need in a sustainable way to make sure that we can fix the system going forward. Next, I have Representative Backer.
Yeah, and thank you. One of the things I think everybody would agree, or most people in this room, is we do have to stop criminalizing mental health. It is important. My question, what behavioral health rates are changed, impacted by this bill?
Representative Edelson.
Thank you, Mr. Chair. And thank you, Representative Backer. I think maybe Ginny, actually, Sue Abderholden is here now. I'm going to phone a friend. Listen, I will tell you, my job in all of this, I'll be very honest, is making sure that there are 18 stakeholders. We are meeting twice a week, and I am making them meet twice a week, that it will be a consensus bill. Okay. And I want to thank staff for making sure we get all these timelines. Representative Keel, I did the civil commitment bill with Sue Abderholden as well, and also the competency attainment. We did get something done there. That was very expensive, but I do think we are going to get something done here. And amazing, Director Grom is here to answer your question.
Director Grom from DHS is here. Thank you for coming down. If you'd like to introduce yourself and please answer the question. Thank you.
Sure, Mr. Chair, for the record, my name is Christy Grom. I'm with the Department of Human Services. So the rate study that is in scope for this bill would include all of our mental health rates, physical health rates, and some of our substance use disorder rates as well. I believe the plan would be to prioritize some of those rates that are most in need of addressing. So for substance use disorder, I believe we're going to be looking at residential services in this bill. And we are in the process of providing technical assistance to make sure that all of the language matches with the intent in the fiscal analysis.
Okay. Thank you. Representative Backer.
Yeah, so I'm assuming, and thank you, and I know there's a lot of rates in this, but when, with the health rates, I'm assuming I know we're not on the financing, but the rates would increase and not decrease. That's the intention of the bill. So the counties are not, and the property tax owners are not footing all the majority of the bills. That's the intent, correct?
Representative Edelson.
Thank you, Mr. Chair. Yeah, the goal is to increase the rates. And then also, the one thing I think the county has really talked about, which they really care about, is the provision, which is the cost individuals are waiting for transfer to a DCT facility. So they are currently covering all the costs on that. So that is absolutely something I know the counties want. And Mr. Freeman is definitely doing his job because I hear about it often.
Okay. Thank you, Representative Edelson. Representative Becker. And then finally, we'll go to Chair Knorr, and then we'll go to the vote.
Thank you so much, Mr. Chair. Thank you, Representative Edelson. I think this is an important issue. We created a task force last year so that we can have a comprehensive plan. So I just wanted to say thank you to the task force for their recommendation. We've got a lot of work to do. And for the topic of the, does not meet criteria, I know we funded the counties for at least this cycle, the budget cycle, but we need to look into how we can provide that support to the counties so that they don't have to incur the ongoing costs. So we've got a lot of work to do. Hopefully by the end of session, we will have a bill that will address the needs when it comes to priority admission. So thank you so much.
Thank you, Chair Noor. Representative Edelson, any closing comments, and would you like to renew your motion?
Closing comments are, I will probably see you in the next 5 committees. So we'll look forward to seeing you, Chair Noor. And thank you. I just ask for your support.
Thank you very much, Representative Edelson. Representative Edelson moves to re-refer House File 4366 as amended to the Public Safety, Finance, and Policy Committee. All those in favor signify by saying aye. Aye. Those opposed say by saying nay. Motion prevails and the bill is re-referred to the Public Safety, Finance Committee.